Hi, my name is Rachel Brooks, and today my presentation is on iron. So iron is a trace mineral, and that means that it's needed in consumptions between 1 and 100 milligrams per day. Even though iron only needs to be consumed in a relatively small amount, its presence in the body is vital. It's instrumental in transporting oxygen and for growth and development, among many other important functions that we will talk about in a little bit. There's two forms of iron, which are heme iron and non-heme iron. Heme iron is primarily found within animal products, and non-heme iron is primarily found within plant foods. Here we have the recommended dietary allowances for males and females and children. And as you can see, these numbers are kind of all over the place. When you're a kid, you need even more iron than you do as an adult because you're growing, and your bodies and your brains really need that extra iron. Now, if you're a woman, you need a lot more iron than a man does because of menstruation. We're losing a lot of blood each month, and so we need to replace the iron lost due to menstruation. Pregnancy is also another time when you need a lot of iron, and that's because we're building a baby and our blood volume is increasing, so we need to have intakes of about 27 milligrams per day. Upper intake levels are pretty similar across the board. You need you don't want to take more than 40 to 45 milligrams a day depending on your life stage. So be careful of those upper intake levels, The functions of iron, the major function is oxygen transport, and we'll talk a little bit more about that in a minute. It's also important in energy metabolism. Iron is a cofactor involved in neurotransmitter synthesis. This process is very important in children who are building their brains because without iron, their cognitive abilities and lifelong brain function can be seriously compromised, which might also be irreversible. Lastly, iron has a major role in infection prevention. Iron is used to build lymphocyte and killer cells, which aid in infection prevention. So hemoglobin is a protein, and it's a protein found within the red blood cells. Within each hemoglobin, there are 4 iron molecules. And this hemoglobin, along with the iron within the protein, are used for carrying oxygen to all of the body tissues. It also carries carbon dioxide to the lungs to be expired. When iron is not present within hemoglobin, the kidneys send a hormonal message that tells the body it needs more blood. The body then creates more blood, which actually causes an increased need for iron. And this is one reason why it's critical to get enough iron in your diet so your body doesn't try and create more blood, which in turn, there's a higher need for iron. It's kind of just a snowball effect here. So next we have myoglobin, which is also a protein and has a similar function as the hemoglobin. It's used to take oxygen from the bloodstream and drop it off to skeletal and heart muscles. So this is the reason why if you are deficient in iron, you are going to feel really tired and weak, maybe short of breath, especially when you're doing some sort of physical activity. Your body's not receiving the oxygen, your muscles and your heart aren't receiving the oxygen that they need to perform those functions. Iron also plays an important role in energy metabolism. Within the mitochondria, iron is needed to carry electrons from NADH plus and FADH2 to oxygen molecules within the electron transport chain. It's also needed in the first step of the citric acid cycle to convert citrate into other compounds. as you could probably tell, this is another reason why your energies will be way down if you don't have enough iron, because your body creates a lot of ATP or energy during the electron transport chain, and even some in the citric acid cycle. So if we don't have that iron, our body is not able to create the needed energy. Here's a list of food sources. The heme iron, again, are the animal products. So we've got just a list here of good sources of iron from animal products. And then on the other side, we have non-heme iron, which are your plant foods that also have a good source of iron. The difference here is that the bioavailability in heme iron is much greater than in non-heme iron. Iron deficiency anemia is what you're going to get if your body does not get enough iron. It's the most common nutrient deficiency in the United States. Iron deficiency can be very dangerous, especially among children who are growing and need it for their cognitive abilities. And the symptoms that might be experienced with iron deficiency anemia are fatigue, poor work and exercise performance. You're going to feel really tired and unable to do the things that you normally can do. You might be more prone to infections. And as mentioned earlier, there may be delays in growth and cognitive impairment and even death. And those who are at high risk are children, teenage girls, women in childbearing years, and those who frequently donate blood. Iron toxicity is another problem that you want to avoid. You might experience nausea, vomiting, diarrhea, stomach irritation, and impaired absorption of other minerals if you are toxic in iron. Accidental iron overdose is the #1 cause of poisoning in children under 6. So if you have iron supplements in the house, be really careful to keep that away from your kids. Here's a few interesting facts that I found while I was researching iron. Up to 60% of colon cancer patients are deficient in iron. Approximately 60% of patients with heart failure are deficient in iron. People with gastrointestinal disorders are at a higher risk for iron deficiency. And the colon cancer patients are likely deficient due to chronic blood loss in their bowel movements. And those with heart failure, the low iron could be due to many different factors, but maybe poor nutrition, malabsorption, defective mobilization of iron stores, and maybe the use of aspirin. In gastrointestinal patients, people that may have Crohn's disease or celiac disease could be experiencing some malabsorption issues, or their restrictions in their diet might not allow for enough iron getting to their tissues and skeletal muscle cells. I find this interesting because people with these chronic issues are probably not thinking much about their iron stores. I think they have a lot more on their mind than iron, but it's really vital during these times that they're obtaining enough iron to help them avoid illness and fatigue as much as possible. I took a look at an article that was very interesting to me. It was called, "Should You Take Iron Supplements to Fight Fatigue?" And the suggested answer in this article was that you should not take an iron supplement without seeing your doctor first.